Welcome back to Spotlight on the Shadow, a series that aims to shine a spotlight on the so-called secondary impacts of COVID-19 in Asia, especially for women and girls. This video is slightly different from the last, as we'll be looking at India's current COVID crisis, its impact, and the secondary impacts it has dealt with over the past year and a half. At the current moment, India is facing one of the most significant crises of the COVID pandemic so far. Since the beginning of April, their cases have risen at astonishing rates. As of May 18, 2021, 4,525 daily deaths of COVID in India were reported, adding to a total of 287,156 recorded deaths in the country. This is the third highest in the world, following the USA and Brazil. However, many deaths are believed to be going unrecorded, which may mean the actual number is much higher. Though there have been 25,772,400 confirmed cases of COVID in India, according to the Ministry of Health and Welfare, this does appear to be slowing down, at least in the past week. That being said, deaths have not yet begun to fall. A lack of universal access to the vaccine is causing huge delays in the eradication of the virus. According to the BMJ, in the past 2 weeks, 567 prominent figures in India have called on Prime Minister Narendra Modi to tackle inequalities in vaccine supply in response to shortages and unregulated prices, meaning many have been unable to access it. There has also been a huge shortage of oxygen, meaning many large centres, including Delhi, are struggling for treatment. Furthermore, there are additional healthcare issues. In Maharashtra, in the last couple of weeks, a rare and lethal fungal infection with a 50% death rate has sprung up in hospitals treating COVID. During this period, there's been a great outcry at the government across India in light of its response to the pandemic. Prime Minister Modi's approval ratings have dropped below 40% for the first time in his career. As well as anger over the government's decisions regarding vaccine rollout, there is current controversy over whether another lockdown should be put in place. The Prime Minister's government opposes it on both economic and social grounds, but both the opposition and the country's COVID task force argues that there is no other option at this stage, and many are deeply critical of the government's slow response. The anger and grief brought about by so many deaths is exacerbated by the horrific practical circumstances under which they must be faced. For example, in the past week, hundreds of people who have died of COVID have been found washed up on the shore of the Ganges, while funeral pyres have been burning night and day, according to BBC correspondent Geeta Pandey. Beyond the immediate and horrific results of the surge in COVID cases and deaths is that an increase in the secondary impacts of the pandemic may be expected too. This has been seen most crucially in the rise in domestic violence, referred to by many as the shadow pandemic, that is threatening a return under the current circumstances. Only a few empirical published studies are available on domestic violence during COVID-19, but during March to April of 2020, the UN reported a 20% increase in domestic violence worldwide. This increase was reflected in India, where the National Commission for Women showed that domestic violence complaints doubled after the nationwide lockdown was imposed. Women in India also suffered from a lack of sufficient healthcare during this period. Access to maternal health care was next to nil, while sanitary products were inaccessible to many women in rural areas who relied on shops being open. Furthermore, around 1.85 million women were denied access to abortion services in India due to the restrictions, according to a recent study conducted by IDF, a Delhi-based non-profit organisation. The response to the rise in domestic violence was relatively swift at the time, with the UN, government and NGOs picking up on and attempting to tackle the violence within the months of May to August 2020. However, there is great concern that these efforts will fall by the wayside as India struggles in the face of this rise in deaths. Even if there is a lockdown, which could be effective in containing the cases, there is a huge risk that the shadow impacts will continue or even worsen. Together, the pandemic and its shadow in India are resulting in one of the darkest moments of the pandemic so far. In order for lives to be saved and for the virus to be contained, there must be a focus on access to supplies across India and an intense effort on the part of the government to ensure that both the pandemic and the fallout are handled with the greatest care possible. If you'd like to learn more or to help, please check out Project Hope, which provides PPE and oxygen to India and worldwide, and Care India, an NGO which provides resources and equipment to India while focusing on women's rights and roles in the community. Thank you for watching this instalment of Spotlight on the Shadow by Jemima Sinclair. Look out for another episode in the coming weeks and feel free to check out the rest of OxSID's term card for more events, podcasts and videos. Welcome back to Spotlight on the Shadow, a series that aims to shine a spotlight on the so-called secondary impacts of COVID-19 in Asia, especially